Hello, Study Nurse IQ family. Welcome back to the channel. I'm Ginny, and today we're doing a quick review over the antibiotic class known as the cephalosporins. Please stick with me to the end as we have 3 NCLEX-style questions to test your knowledge on the material. Let's get started. Cephalosporins, the next generation. The cephalosporin class is a huge group of antibiotics, and they all share a common prefix, ceph or ceph. It can be spelled either way, like CEF or CEPH. Some popular and frequently used cephalosporins that you'll see in clinical practice include ceftriaxone, often known by the brand name Rocephin, and cephalexin, Keflex. Mechanism of action? Cephalosporins work just like the penicillins we talked about in the last video. They have a bactericidal effect on the body, meaning they actively kill the bacteria. They achieve this by inhibiting bacterial cell wall synthesis. By interfering with the building of the cell wall, they cause the bacteria to essentially explode or lyse. This broad coverage makes them great at treating many different kinds of infections, such as pneumonia, urinary tract infections, skin infections. They are also widely used pre-op or before a patient has surgery as a prophylactic measure to prevent surgical site infections. An especially cool fact is that some of those later generations can actually cross the blood-brain barrier, making them effective at treating serious central nervous system (CNS) infections like meningitis. What you must remember, the cephalomnemonic. To help you remember the most critical things about this class for the NCLEX and for practice, let's look at the first part of the word, CEPHALO. C is for creatinine and bun. You must monitor the kidneys because this medication class can be nephrotoxic, toxic to the kidneys. Always check the patient's creatinine and blood urea nitrogen (BUN) levels to watch for signs of kidney damage or impaired kidney function. E is for ethanol intolerance alcohol. Patients must know that they should have no alcohol with this class of medication. Taking cephalosporins with alcohol carries a risk of a disulfiram-like reaction. This reaction can cause severe flushing, headache, nausea, vomiting, chest pain, and other unpleasant effects. The rule of thumb is to avoid alcohol during treatment and even up to 72 hours after treatment is finished, depending on the specific medication. P is for pseudomembranous colitis, C. diff. Like many broad-spectrum antibiotics, cephalosporins are associated with a risk of Clostridium difficile, C. diff infection, which leads to pseudomembranous colitis. Watch for classic signs like watery, foul-smelling diarrhea and fever. H is for hypersensitivity. This is the big one. You must always ask about a penicillin allergy. There is a risk of cross-sensitivity or cross-reactivity between penicillins and cephalosporins because they share a similar chemical structure, the beta-lactam ring. While the risk is generally low, it's still a crucial safety check. Always monitor your patient for signs of an allergic reaction, such as a rash or, worst-case scenario, anaphylaxis. A is for administration routes. Be aware of how you are giving the medication. If you are giving it intravenously IV, you need to watch out for phlebitis, inflammation of the vein, because these medications can be harsh on the veins. If you are giving it intramuscularly, IM, via injection, you must use a large muscle, such as the ventrogluteal route, to minimize pain and tissue damage. L is for lower prothrombin. Some medications in this class can actually interfere with vitamin K production. This interference can lead to a lower prothrombin level, which can increase the patient's risk of bleeding. Therefore, you need to monitor the patient's prothrombin time, PT, and international normalized ratio, INR. We'll stop there because CEPHAL covers the most important points. Now, let's test your knowledge with those NCLEX-style questions. Question 1. A patient is prescribed a second-generation cephalosporin. The nurse should prioritize assessing the patient for which of the following before administering the medication. A. History of hypertension. B. Recent consumption of grapefruit juice. C. Allergy to penicillin. D. Diagnosis of type 2 diabetes mellitus. The answer is C. Allergy to penicillin. Rationale. Due to a shared chemical structure, the beta-lactam ring, there is a potential for cross-sensitivity between cephalosporins and penicillins. Therefore, the The nurse must always ask about a patient's history of penicillin allergy as a crucial safety check before administering a cephalosporin. Question 2. A patient taking a cephalosporin calls the clinic to report severe flushing, headache, and vomiting shortly after having a beer with dinner. The nurse recognizes this reaction is due to the drug's potential for A. Nephrotoxicity leading to fluid imbalance. B. Disulfiram-like reaction when consumed with alcohol. C. Increased prothrombin time, PT, and bleeding. D. Development of pseudomembranous colitis. The answer is B. Disulfiram-like reaction when consumed with alcohol. Rationale. Cephalosporins carry a risk of a disulfiram-like reaction when taken concurrently with alcohol. Symptoms are severe and include flushing, headache, nausea, vomiting, and chest pain. Patients must be taught to avoid alcohol during therapy and for up to 72 hours after finishing the medication. Question 3. Which laboratory value is most critical for the nurse to monitor for a patient receiving a cephalosporin intravenously, IV, due to the risk of nephrotoxicity? A. Blood glucose, serum potassium. C. White blood cell WBC count. D. Creatinine and BUN. The answer is D. Creatinine and BUN. Rationale. Cephalosporins can be nephrotoxic, damaging to the kidneys. The most direct and critical laboratory indicators of kidney function are creatinine and blood urea nitrogen, BUN. Monitoring these levels helps the nurse detect early signs of drug-induced kidney impairment. That wraps up this review on cephalosporins. We covered their mechanism of action, their broad coverage, and the crucial safety points you need to remember. If this video was of value or added value to you, please head to our YouTube channel, Study Nurse IQ, and click subscribe. We'll be continuing our antibiotic series in the next video. I'm Jenny, and I'll see you next time.